here at Dr. Brigdeman, I have been having a lot of back pain, lower back pain, upper back pain. I've done, 2 treatments already, and the significant improvement. So I'm gonna let you explain.
Yeah, so what we're gonna do is we're gonna take her through our patient treatment assessment, then we'll follow up with the laser treatment. We'll kind of tell you what we're doing as we go along. First test, we're gonna check her shoulder range, so just let her relax, we'll raise her up. So this is a perfect example of how a shoulder should move. The arm reaches that excellent shoulder mobility, okay? So we're gonna go ahead and move now onto your back. We'll start with some testing. Knees up, feet together. The first test is the adductor or the inner thigh muscles. We'll go right here, squeeze together. Good. What we're looking for on these tests is either weakness or pain. Weakness means the joint or the spine needs to be adjusted. Pain indicates that the muscle we're testing is irritated. So now we'll move down. We'll hold this leg straight up, push up, hold it, hold. So this is a hip that's weak. Hold this one up, push up, hold. This hip is strong. Relax, we're gonna adjust the left hip, just like this. Got it. We even felt and heard a release. We'll test it again, up, hold it up, and push up. And she's definitely stronger. Good. Now, we'll move into the spine. We're gonna go leg up, we'll turn the foot out. We're gonna test the iliopsoas muscle. So hold right here and hold. Good. Turn the foot in. Push out. Good. That's L4, the IT band. Bend the knee, push right here, hold, rectus femoris. Keep it straight, push out, hold, and she's weak on L4, which is the IT band. Bend the knee, push straight here, rectus is good, and a hold. So she's good there. She's got a sacrum on this side, L4 on this side. The sacrum, so if you get the low back, the sacrum is a triangular bone. It's actually 5 naturally fused vertebrae that forms the sacroiliac joint. So we'll set her up here. Now I'm going to make a contact right on the sacrum. We'll bring her over. We're going to move into the L4. So we'll bring this up. There we go. We've adjusted the sacrum, which is here. The L5 is here. L4 is here. So we're going to contact our L4. We'll bring her over. And we go just like that. Each different test, we're testing a different muscle, and we're testing different levels of the spinal column and or the extremity. So we'll pull in here. This is the rhomboid test. Hold. The rhomboid is the muscle in between the shoulder blade and the spine. We go right here. We're testing the triceps. So we're testing the elbow. Push, pull. That's how you test the bicep. Right here, hold the coracobrachialis. We go straight arm, thumb down. Hold right here. Hold. That's testing the pectoralis. So she's got great strength, which tells us the extremities are holding. We're going to adjust the mid-thoracic right in through here. Scoot down just a little bit. Right there's perfect. Chin to chest. We're going to bring her up. Drop this down. Right there. We got one more. We'll go head down. Right in here. Got it. Excellent. Moving to the cervical spine or the neck. Now with Anjali's neck, also as a competitive swimmer, right? A lot of neck rotations throughout the year, a lot of upper body work. So we're going to be working the levator scapulae, which is a level 2 muscle. It goes from C1, 2, 3, and then it runs down and attaches to the tip of the shoulder blade. So a lot of people who have this shoulder blade pain right at the top, that's the levator. And so what we'll do, we're going to laterally bend so the muscles shorten, and then we're going to take her over to the other side as I'm working through the muscle fiber towards its insertion point. This will reduce the scar tissue that's developed in the tissue. So when muscles are in spasm or you get injured, they build up with lactic acid and calcium, which turns into scar tissue. And what happens, the muscle loses its resiliency. So it should be elastic, stretchy like a rubber band, but what happens as you get those knots and adhesions, it becomes very rope-like. Rope-like muscles are weak, prone to fatigue, and they affect the biomechanics. Now we're going to palpate through the neck. Palpate means we're going to feel how the joints move. So down low, she moves good to the right. On this side, we can feel it lock up, and then as we get upper, you can feel it's locked up. So she's got a lower on the right, upper on the left. So we're going to start right in here. We're going to go nice and easy. Good. Let's bring C6 over. Got it. Now, so right here, I call this the trifecta. You got 3 muscles that attach to the tip of the scapula. One comes from the neck, then the other comes from the mid-back, and then you've got a rotator cuff muscle that starts here and travels to here, and it creates this big knot. Almost everybody's got it, and we got to work it out. So we're going to bring the arm up. We'll start her here. We're going to go down, and she's going to move it across. Got it? Bring her up, take her down and across. And we're going to work through it. So again, we're going to actively take the muscle through its range of motion while we exert specific pressure. There it is. And you probably even hear it at the end of that movement. It's got a clump because there's a buildup of scar tissue in there, and we're going to release it. As we release this tissue, that allows blood to start infiltrating and nourishing and healing the tissue. So here we're physically breaking up the scar tissue. Then we're going to finish things up by putting a healing laser, which is going to help clear out and stimulate a healing response, giving her a 30 to 40% faster recovery. She says that she feels like this is where all her pain comes from. There's a muscle underneath the rhomboid. It's called the serratus posterior superior, and it's actually hidden under the scapula, and you can't get to it without pulling the scapula out the way. So we're going to have you reach forward and then come across, okay? Right here, go. Yep, there she is.
Yes, it
Oh,
feels
it's
so
right there.
good.
Hurts so good, doesn't it? To the nervous system, arms up, hold. Now rotate the head, hold. This way, hold. So when she turns to the right, it weakens the neck. Relax. Here's how the testing works. Normal, healthy person holds the arms up. When she turns her head, we're kinking the spinal cord. If there's compression on the nerves, it will actually cause the weakness in the muscle. So when she turned her head this way, it caused her to go weak. So we're going to go back to neutral. And this is where we use the instrument. Many people are afraid or have had bad experience with hands-on adjustments. That's where the instrument comes in because it's very gentle and it can do what manual adjustment doesn't do. So we're going to gently adjust while we take her neck through the motion that was causing the weakness. This is micro adjustment to the segments, restoring motion and stimulating the nervous system. Then we're going to move gentle lateral bending. So like if you've been in a car accident, if you have whiplash, if you're a football player who's had neck trauma, you can't go crunching the neck. You have to be very gentle with it in its recovery, and the instrument allows us to do so. So we'll go gentle, lateral bending. Now we're going to flex the head down, and then we're going to bring her up, just like this, nice and easy. Down, and I'll work my way up the cervical spine, guiding her head through our ranges, restoring that movement with gentle stimulus of the joint. We do one more, right up through here. Good. Let's test the rotation again. Turn your head over here and hold. So she's strong in rotation. Hold, she's strong in rotation. Next. All right, so as you can see, so this is, we're checking the parameters. So the laser's gonna go all through here, right up through this neck, okay? Now, we'll start the laser. Now the laser's begun. So this laser, now you can see with the laser on a camera, you can actually see the laser beams, right? To the naked eye, you can't see it. So the laser, robotic, it's gonna basically paint this area with laser treatment. Laser is subsensory, means your body doesn't even feel it. You may feel some energy, but there's no heat. Okay, so it's not gonna burn the tissue or overheat it. It's gonna provide a stimulus to the mitochondria, which is gonna increase your healing capacity 30 to 40% faster. So this is a great adjunct to the treatment, and it helps reduce pain, promoting the healing. So we'll let it do its work, just like that, okay?
So I just finished my chiropractic appointment and I feel amazing. Literally the best chiropractor in Washington. If you haven't already, follow Dr. Brigdeman, book your appointment.